Welcome to The Explainer. This is where we take complex topics and, break them down for you. And today we're tackling kidney stones. It's this incredibly painful condition that is way, way more common than you'd probably guess. And we're really going to dive into this through the eyes of people who've actually been through it. This quote here from Kim, wow, she's been dealing with stones for decades. And it just hits you, right? It gets to the very heart of why we're talking about this. If you can just understand what's happening, that's the first huge step to making sure it doesn't happen to you.
1 in 10. Just let that sink in. And what's crazy is that this number is on the move. I mean, if you go back to the 80s, it was more like 3 in 100. So we've jumped from that to 1 in 10. The rates are climbing. And it's happening to everyone, women, even kids. And while the why is complicated, a lot of experts are looking at things like our modern diets and, get this, even climate change, which can lead to more dehydration. It just makes this whole conversation feel, well, pretty urgent.
All right, so let's get into it. For most people, the journey with a kidney stone starts in one place, pain. And we're not talking about a little ache. It just shows up, out of nowhere, with a set of symptoms that you just can't ignore.
So that sharp, cramping pain that just keeps coming in waves, what you're feeling is your body literally trying to push a solid rock through a tiny, tiny tube called the ureter. It's a physical blockage. And all the other stuff on this list, the nausea, the feeling like you have to pee all the time, everything, it's all your body reacting to that internal battle. Okay, so we know what it feels like, which is awful. But what exactly is a kidney stone? Let's take a look at the science behind all that pain. It's actually pretty simple when you break it down. Your urine is full of all these dissolved minerals, right? Well, when you don't have enough water in your system, your urine gets super concentrated. And when that happens, those minerals can't stay dissolved anymore. So they start to form crystals. And then those crystals clump together into a hard little object. And they start small, but believe me, they can get big, like big enough to fill up the inside of your kidney. Right, so not all stones are the same. You can see here the vast majority, like 80%, are calcium-based. But, and this is super important, knowing which type you have is everything. It's like finding the right key for a lock. Figuring out what a stone is made of is absolutely crucial for figuring out how to treat it and, more importantly, how to stop it from coming back. And this chart just lays it out so perfectly. You see, struvite stones are all about infections, like UTIs. Uric acid stones? Well, that often points back to diet, especially a lot of meat. And then you have cystine stones, which are caused by a rare genetic thing. So each type of stone is basically a clue. It tells a completely different story about what's going on inside your body. So picture this. Someone lands in the ER with that classic, awful pain. How do doctors actually figure out for sure that it's a kidney stone? You know, for a lot of people, these stones can just hang out in the kidney without causing any trouble at all. They're totally silent until they start to move. And that sudden, crazy pain, that's your body's alarm bell, pretty much screaming that it's time to see a doctor. And that's what gets the whole diagnostic process started. So doctors have this whole arsenal of tools to get to the bottom of it. In the emergency room, the go-to is usually a CT scan. It's super fast and gives them a perfect picture of exactly where the stone is and how big it is. But they don't stop there. They'll do urine and blood tests, kind of looking for clues about why it formed in the first place. And here's the real pro tip. If you've had a stone before, analyzing it, literally putting it under a microscope, is the absolute best way to create a plan to stop the next one. Okay, so the stone has been found. Now what? The big question becomes, what's the plan of attack? And picking the right treatment is, well, it's the most critical next step. Really, it comes down to a fork in the road. Do we wait it out, or do we go in and get it? For smaller stones, a lot of the time your body can handle it, with lots of water and maybe some medicine to help things relax. But if that stone is just too big, or the pain is out of control, or it's actually blocking things up, that's when it's time to call in the surgeons. And the surgery for this stuff today is just incredible. Take this procedure, a ureteroscopy. The doctor uses this tiny little scope and goes in through your body's natural plumbing. No cuts, no incisions. They can literally see the stone on a screen in real time. Then they can either grab it with a tiny little basket or just zap it with a laser. It's so precise and so minimally invasive. And that's not the only option. There's something called shockwave lithotripsy,
where they use these powerful sound waves from outside your body to basically shatter the stone into tiny pieces you can pass. Then, for the really, really big ones, I'm talking about the monster stones, there's a procedure called PCNL. That's where they make a tiny little incision in your back to go in and get it directly. It's for the toughest cases.
All right, the stone is gone. You'd think the story ends there, right? Wrong. This is actually where the most important part of the journey begins, because once you've had one stone, your chances of getting another one go way up. So the whole game shifts to one thing: prevention.
If you remember literally one thing from this entire explainer, make it this number: 2.5 liters. That's how much urine you want to be making every single day. Now to do that, you've got to drink about 3 liters of fluid. Water is best. Seriously, this one single habit is the most powerful weapon you have. It keeps your urine diluted and makes it almost impossible for those nasty crystals to form in the first place.
And of course, past just drinking water, what you eat makes a big difference. And check this out. It doesn't say to avoid calcium, which might surprise you. Actually, eating things with calcium with your meals is a good thing. It helps block another stone former called oxalate from ever getting to your kidneys. Really, it just comes down to a good, balanced diet with plenty of fruits and veggies.
So what should you cut back on? Well, salt is a huge one. It basically forces more calcium into your urine, which is exactly what you don't want. Too much meat and fish can also be a problem because it makes your urine more acidic. And for some people, they might need to watch out for certain high oxalate foods like spinach or almonds.
But you know, sometimes diet and hydration just aren't enough. Your body chemistry might just be hardwired to make stones. And that's okay, because that's when doctors can bring in medications. They have drugs that can basically change the chemistry of your urine, making it less acidic or tricking your body into holding onto calcium instead of putting it in your urine. These are some seriously powerful tools for tipping the scales in your favor. So, this is it. This is the question that everyone who's ever had a kidney stone has to ask themselves. The stats are pretty blunt. Half of them will get another one. But here's the thing. It's not a 50-50 coin toss. It's not about luck. Everything we've just talked about, the water, the diet, the medical options, it all puts the control right back in your hands. So the power to be in that half that doesn't get another stone, that's not luck. It's a choice. The only real question left is, which half are you going to be in?